Dr. Abdullah here, and I'll be explaining to you some of the cranial nerves and also the triangles of the neck, their boundaries and their content. So these are the contents of our lecture. We're just going to mention a very quick introduction about the cranial nerve nuclei and where they are, and a few tips and tricks about the cranial nerve. And then we're going to talk very quickly about the function of each cranial nerve. And then moving on, we'll have to talk about 3 of the cranial nerves. Cranial nerve number 2, which is called the optic nerve, and the vestibulocochlear nerve, which is cranial nerve number 8, and the glossopharyngeal nerve, which is cranial nerve number 9. And then for each one, so for example, the optic nerve, we have to cover a few things in the pathway of that nerve. Where is it coming from, the origin? And then talking about the optic chiasm, and then the optic tract, and then finally something called the lateral genicular body. And moving to the end, you're going to have to talk about the visual reflexes and also before that optic radiation. Moving forward, we're going to speak about the vestibulocochlear nerve. This is cranial nerve number 8, and as you can see, it's formed of the vestibular nerve and also the cochlear nerve, and we're going to talk about each one of them very, very quickly. All right. And finally, we're going to end by talking about the glossopharyngeal nerve. We need to talk about the course of that nerve and how it comes out from the skull. And we have some cool pictures here. And then finally, the motor nuclei, the inferior salivary nucleus, and the sensory nucleus. And these are the nuclei of the glossopharyngeal nerve, and including the anterior and posterior triangle. We talk about their boundaries and also the contents of each one of them. All right, so this is today's lecture. Our introduction, I'm going to mention briefly a few things about the cranial nerves nuclei. Of course, we have 12 cranial nerves, all right? So we have 12 pairs. It's very important to say that we have 12 pairs of cranial nerves, all right? And these cranial nerves, we need to notice a few notes about them. So first of all the cranial nerve nuclei come from the lateral side of the brainstem. All of them come from the lateral side of the brainstem, apart from 4 cranial nerves. And these include cranial nerve number 12, cranial nerve number 6, cranial nerve number 4, and the cranial nerve number 3. As you can see, 12 can be divided by 6, and can be divided by 4, and can be divided by 3, and this is how I like to remember it, all right? So you have, apart from 4 cranial nerves, those 4 come from the midline. So for instance, if this is the brainstem, okay? So cranial nerve number 3 and 4 and 6 and 12 nuclei will be in the midline, but otherwise will be coming from the lateral surface of the brainstem, and it's going to be clear in that one in a minute. Okay. The other thing about the pairs of the cranial nerve, all of them arise from the anterior surface of the brainstem, apart from only one nerve, and this one nerve is the 4th cranial nerve, which is called the trochlear cranial nerve. Okay, so there is in this diagram, of course, here we're looking from the posterior. You can see this is the 4th ventricle, all right? This is the 4th ventricle, the tent here, right? So you have multiple nuclei. The key part in this image is to tell you what are the nuclei in the midline. You can see number 1, this is the oculomotor nucleus. It is definitely in the midline, okay? 2, this is the trochlear nucleus. And you can see that the trochlear nucleus is the nerve is coming posteriorly as well, because you are on the posterior surface. But all of them, you can see they are a little bit faded because they are coming from the anterior surface. Okay, so this is the 4th cranial nerve nuclei, again in the midline. Okay, and then you will have the 6th cranial nerve nuclei as well, or the abducent nucleus, again will be in the midline, and which is right there. This is the abducent cranial nerve nuclei in the midline. And finally, you have the hypoglossal nerve, again in the midline. Okay, so you have 4 cranial nerves nuclei come from the midline, and all the rest come from the lateral part of the cranial nerve of the brainstem. Okay. Here you have a lateral view, and the only reason why I'm showing you this lateral view, you can see all the cranial nerve moving anteriorly, coming anteriorly, all of them, apart from this tiny nerve, which comes from the posterior border, and this is the trochlear nerve. Okay, the trochlear nerve comes from the posterior part of the brainstem. Okay. There is another rule to understand about the cranial nerve, and this rule is the 2, 2, 4, 4. Okay, so when you calculate that, that would be 12, right? So 2 of the cranial nerves come from the cerebrum, and this is cranial nerve 1 and 2. And the next 2 come from the midbrain, and this is cranial nerve 3 and 4. And the next 4 come from the medulla. Okay, sorry, the pons. The next 4 come from the pons, and the next 4 comes from the medulla. So this can be an MCQ question. I can ask you the nucleus of the vagus nerve originates from, and then give you option midbrain, pons, medulla, and cerebrum, and you can start calculating. This is cranial nerve number 10, and 10 will lie in the last 4, so likely from the medulla. All right, so this can be multiple choice questions. You can identify here, of course, this is the midbrain. You will find out that the trochlear nerve and the oculomotor come from the midbrain, and then it stops. And then you have the cranial nerve number 5 and number 6 and number 7, and also the vestibulocochlear nerve. They all come from the pons. And then you have the medulla, which will have the accessory meningeal 11, the glossopharyngeal nerve as well. So 9, 10, 11, and 12, basically, right? 10 is the vagus nerve, and 11 and also the 12 nerve, which is the hypoglossal nerve, come from the medulla. Okay, so these are a few facts to know about the cranial nerves, and I'm going to revise them to you here. So all of the cranial nerve nuclei come from the brainstem, the lateral part of the brainstem, apart from the 3, the 4, the 6, and 12. They can all be divided by 12. Okay, and all cranial nerves arise from the anterior surface, apart from just one nerve, which is the trochlear nerve. Right, the fourth cranial nerve comes from the posterior, and again we talked about that. And finally, you know the 2-2-4-4 rule, and also some cranial nerves carry parasympathetic fibers, and these are 1973. What I mean by that, cranial nerve number 10, cranial nerve number 9, cranial nerve number 7, and the cranial nerve number 3, they all carry parasympathetic. Okay, again, this can be a multiple choice question. I can ask you that all the following cranial nerve carries parasympathetic except, and then give you options. And usually we confuse you with the optic nerve, all right? The optic nerve number 2. It's 1973, all right? So this is a 3D model here that gives you the origins of these nuclei. And again, it's the same concept. You need to know that it is 2, 2, 3, 4, 4. So oculomotor nerve coming from there. And this is the trochlear nerve coming from the posterior and pointing anteriorly, all right? So that's oculomotor, and that's trochlear nerve. And then you will go to the, that's midbrain, of course, and then you will go to pons, all right? The pons will have the trigeminal nerve, and that's laterally, and then the abducent nerve, again, slightly towards the midline, and then you have the trigeminal abducent, and then facial and vestibulocochlear nerve. These are coming from the pons, and the medulla. You will have the spinal accessory nerve, you will have the hypoglossal nerve, you will have the vagus nerve, and also the glossopharyngeal nerve just right there. All of them are coming from the medulla, all right? All of them are coming from the medulla. Cool. Moving forward, so just the function of the cranial nerves will be explained to you very, very quickly. So we have, like we said, we have 12 cranial nerves, 2 of them coming from the cerebrum, and these are olfactory nerve and optic nerve. As you can see here, this is from Netta's anatomy. It's showing you a few function of the cranial nerves. Cranial nerve number 2 is important for olfaction, or the nasal cavity, and the sense of smell. All right, and then cranial nerve number 2 is very important for the vision. All right, so it's your vision. As you can see, there is an eye there. And cranial nerve number 3 and 4 and 6. 3, 4, and 6. Okay, cranial nerve, oculomotor nerve, and also trochlear nerve and cranial nerve number 6. They usually go together because they are very important for the movement of the extraocular muscles. Okay, and then cranial nerve number 5, or the trigeminal nerve, is very important for sensation. It has 3 divisions at the end, and it's very important for sensations in the face and the muscles of deglutition as well, or chewing food. Okay, cranial nerve number 7, it's important for your smile, and it's important for closing your eye, and it's important for your hearing as well. And then cranial nerve number and the taste as well, right? You have the chorda tympani, so cranial nerve 7 is important for sense of taste as well. Cranial nerve number 8, this is vestibulocochlear, and it's 2 nerve. The cochlear one is responsible for your balance, okay? And the vestibular nerve is very important for, the cochlear nerve is important for your hearing, and the vestibular nerve is important for your balance, okay? In the glossopharyngeal nerve, that's important for the taste, okay? And it has some motor function for the stylopharyngeus muscle, the only muscle that it provides. And then vagus nerve, this is important for lots of things, including your heart, lung, and palate, and pharynx, and larynx, and trachea, and bronchi, and also sensation for your heart and the GI tract. 11 and 12, the 12 is very important for your tongue muscles, and 11 important for your neck muscles, all right? So this is just a quick diagrammatic representation of the function of each cranial nerve, and you can also see where they originate from the brain. You can see 1 and 2 coming from the cerebrum, 3 and 4 coming from midbrain, 5, 6, 7, and 8 coming from pons, 9, 10, 11, 12 coming from the medulla oblongata. So now we're going to talk about the first cranial nerve in our lecture, and this is the optic nerve, or the second cranial nerve number 2. And the optic nerve, or the visual pathway in general, we're going to divide it from the origin, and that will be the optic nerve up till here. So till here, this is called the optic nerve, okay? And then that crossing area is called the optic chiasm. And then after that, you have something called the optic tract. And after the optic tract, they will relay into the lateral genicular body. And following that, you will have an optic radiation, or the visual cortex in the occipital lobe. All right. So it's very important to divide it like that. And we're going to talk briefly about each part of this pathway. So first of all, you have optic nerve, and then you have optic chiasm, and then you have optic tract, and then you have lateral genicular body, finally optic radiation, and we're going to be done with the optic nerve by that point. All right, so let's start by talking about the optic nerve, but I'm just going to establish a few basics first. So you know that of course, from here, this is the nose, all right, that's the nose. And on each side, there will be the temporal bone. This is called the temporal bone. And of course, this is the eyeball, and this is the nasal side of the eyeball, and this is the temporal side of the eyeball. However, it's quite important to see that the nasal side of the eyeball is able to visualize the temporal side of the space, right? Or what you can see in front of you. And the temporal side of the eyeball, which is this one, is able to visualize the nasal side of the space in front of you. Okay, so it's, again, the vision is crossed. Okay, and it's particularly important. I'm going to explain later on why this is important. Okay, so it's very important to specify which part you're talking about. Is it the temporal side of the eyeball, or the temporal side of the visual field? Okay, or the field of the vision. So let's start by talking about the optic nerve. The optic nerve, it originates from the retina. Okay, it's called the ganglionic layer of the retina. and the fibers will converge or come together to form the optic nerve. And then they will leave the eyeball through a canal called the optic canal. Optic canal, which we explained previously in the skull bones. Okay, so it will leave the eyeball through the optic canal around 3 to 4 millimeter towards the nasal side, because this is the nose. And then they will continue all the way down until they form the optic chiasm. So it unites with the, so both optic nerve will unite together to form the optic chiasm. Okay, the fibers of the optic nerve are myelinated fibers, and the sheath is formed of cells called the oligodendrocyte rather than Schwann cells. Okay, fine, but I wouldn't worry about this area. What you need to know is, you need to know that the optic nerve, it originates from the retina, the ganglionic layer of the retina, and then the fibers will come together or will converge to form the optic nerve, and then it leaves the eyeball through the optic canal just 3 to 4 millimeters towards the nasal side, and then it unites with the optic nerve from the other side to form the optic chiasma. Okay, we're going to talk about optic chiasma now, but this diagram is good, is particularly good for one thing. You can identify here, I'm going to start by red, that the fibers from the nasal side of the eye, of course this is the nasal side, right? The fibers from the nasal side of the eye come all the way down, and then they cross to the other side. And you can also see that the fibers from the nasal side of the other eye come all the way down, and then they cross to the other side. And you can see the fibers on the temporal side of both sides of the eye will continue all the way down without making any crossing. Okay, that's particularly important to identify which side of the vision will be affected later on. So we're going to talk about the lesions at the end of the optic nerve, but particularly important to know now that the fibers on both nasal side will cross to the opposite side. Okay, very good. So talking about optic chiasm, so optic chiasm, it's the union between the two optic nerve on both sides. You can identify here, this is the chiasm, and it's basically the union between the two optic nerves on both sides. They are present on the floor of the third ventricle. That's the third ventricle, and it's present on the floor of the third ventricle. The anterolateral angle is continuous with the optic nerve, and the posterolateral angle is continuous with the optic tract. And we talked about the crossing of fibers. You can see here as well, the fibers on the nasal side, on both sides, in the nasal side of the eye, they cross to the opposite direction. And the fibers on the temporal side, they don't really cross to the others, but they continue on the same manner. Okay, so let's go back. So the junction between the anterior wall, it's present at the junction of the anterior wall and the floor of the third ventricle. Its anterolateral angle is continuous with the optic nerve, and posterolateral angle is continuous with the optic tract. And in the chiasm, we talked of fibers from the nasal side will cross, and the fiber from the temporal side will not cross. We know the origin that we mentioned earlier, it comes from the ganglionic layer, of the retina, and this is the ganglionic layer. Okay, basically it's the most superficial layer. So the nerve originates from the ganglionic layer of the retina. Again, this can be a multiple choice question. And then moving on, the optic tract. The optic tract, it emerges from the optic chiasm and then passes posterolaterally around the cerebral peduncle. So you can see here, this is the optic tract, and these are basically called the cerebral peduncles. Okay, most of the fibers will terminate by synapsing into the lateral geniculate body, and this is the lateral geniculate body on both sides. Just a few fibers will pass to something called pretectal nucleus and the superior colliculus of the midbrain, but I wouldn't worry about this for now. What I need to worry about that the optic tract is a continuation of the posterolateral continuation of the chiasm. It's a posterolateral continuation of the chiasm, and then they will pass laterally to the cerebral peduncles, and they will terminate into the lateral geniculate body. To talk about lateral geniculate body briefly as well. So it's a very small and oval swelling from something called the palniver of the thalamus. So it's part of the thalamus. It's formed of 6 layers, and axons will synapse into the lateral geniculate body, and the axons of the nerves within it will leave it to form the optic radiation. All right. Optic radiation is the termination of these fibers, and it's responsible for identification of imaging and correcting the imaging. So this is responsible for giving you the final image, and this is area 18 and 19 into your cerebrum. So we have a few cadaveric images here. So starting by the first one, of course you can see this is the optic nerve. Let's start by the first image here. So you can see this is the optic nerve, and we talked about it. The optic nerve, what you need to know is it originates from the ganglionic layer of the retina, and then it leaves the eye from the optic canal, and then you need to know that it's just a few millimeter, about 4 millimeter to the nasal side. And you know the fibers from the nasal side will cross to the opposite side, and the fibers from the temporal side will just continue all the way down to the optic tract. And then you can identify here, this is the optic chiasm, and the optic chiasm, it has an anterolateral border and a posterolateral border. The anterolateral border is continuous with the optic nerve. The posterolateral border is continuous with the optic tract, and it's present on the floor of the third ventricle. And we know the decussation of fibers that happen here, or the crossing of the fibers. And then we talked about the optic tract after that, and the optic tract is the continuation of the optic chiasm, and it will just move laterally to the cerebral peduncle, and then they will terminate into the lateral geniculate body, and the lateral geniculate body is very clear here. So you can see this is optic chiasm, and this is optic tract, and they will terminate into the lateral geniculate body, which is very similar here, the lateral geniculate body. Okay, and the lateral geniculate body, we know that it's a little bit of a swelling into the palniver of the thalamus, and it's responsible for synapsing of fibers from the optic tract into it, and they will terminate by forming the optic radiation, at the end. All right. So again, you can identify on this one, you have optic nerve, and then optic chiasm, and then optic tract, and then optic radiation at the end. And these are sort of some swelling that are present there. Looks like the cerebral peduncles. Okay, so this is the optic nerve. Just to summarize the bit that I was talking about, the injuries that can happen and what will be the sequelae of these injuries. So basically, I'm going to ask you a few questions and just try to be sort of rational thinking about it. So basically, let's say we know now that the nasal side of the retina is responsible for the temporal field, and the temporal side of the retina is responsible for the nasal field, right? So I'm going to ask you a few questions. Try to imagine, what if you started cutting these fibers? What do you think is going to happen to the patient? So basically, all the impulses that's coming from the nasal side will not be able to cross. And from the temporal side, so temporal side and nasal side are unable to cross. So the patient will be blind on this side. Of course, if you cut it on the other side, the patient will be blind as well. So injury to the optic nerve leads to unilateral blindness or ipsilateral blindness. Okay, what about optic chiasm? What about the patient you started cutting here? So basically, the fibers from the nasal side of the retina on this side will not be able to cross or pass. And the nasal side here will not be able to pass as well. So basically, the patient is unable to see on the temporal side of his visual field. So the patient will have something called bitemporal hemianopia. Basically, patient is blind on the temporal side. Okay, so let's move beyond this as well. You started cutting the optic tract here. See what happens. Follow the fibers. The patient on the nasal side of this eye is unable to see. And on the other side, the patient on this side, which is the temporal side of the eyeball, is unable to see. So what are you going to call this? So this is called homonymous or similar hemianopia. So the patient is unable to see on one half of the visual field, right? So this half of the visual field, the patient will be unable to see at all. So if I'm gonna make a representation to homonymous hemianopia to the visual field, if this is the visual field on both sides, the patient will be completely dark on one side. So will be dark, and will be dark, and we call it homonymous hemianopia. Okay. All right. So this is just a few clinical application to the injuries of the different areas of the visual pathway. There are a few other important things to know as well. Something called the visual reflexes of the eye, and we have three visual reflexes to talk about. And these are the direct and indirect, or the consensual light reflex, direct and indirect light reflex. And we also have the accommodation reflex. And we'll finally have the corneal reflex as well. Okay, I'm gonna add some videos on the representation of these reflexes, and of course I'm gonna explain how do they happen as well. So direct and indirect reflex, this is basically when you shine light on one eye, the pupil will constrict, will become small. But it will constrict on the eye that you shined some light on, so ipsilateral, and also the other eye as well. So the ipsilateral constriction of the eye that you shine some light on is called direct reflex. So direct reflex, it's constriction of the pupil on the eye which the light is shown. And the consensual right reflex is the constriction of the opposite pupil, even though no light fell on that eye. Okay, so this is a direct and a consensual light reflex. So let's talk about the pathway. The pathway of the visual reflex, the direct and the consensual right reflex, goes as the following. It all starts from the optic nerve, and then goes to the optic chiasm, and after that we'll go to the optic tract. Okay, the optic tract. And then it will go to something called the pretectal nucleus, which is present in the midbrain. The pretectal nucleus, just very close to the superior colliculus. This should be covered in the midbrain. And then the impulse will come from the pretectal nucleus to a parasympathetic fibers of Edinger vestibular nuclei. This is of the third nerve. Remember when we talked earlier that 1973, right, is parasympathetic. So here you want to go parasympathetic of the third cranial nerve. The fibers will stay, and it's called the parasympathetic nerve fibers, and then travel through the third cranial nerve, which is the oculomotor nerve, to the ciliary ganglion. The postganglionic fibers will come through the short ciliary nerve, and this nerve can goes pupillary constriction, that's pupil constriction, to both eyes, right? Pupil constriction to both eyes. So the both pupils constrict on the consensual right reflex because the pretectal nucleus basically send impulse or parasympathetic fibers to both eyes, into both sides of the midbrain, and the fiber that cross the median plane so close, the cerebral aqueduct, and the posterior commissure as well. You don't have to worry about the last bit, but what you need to remember here, so that you have an afferent, okay, that you have an afferent, and the afferent comes through the optic nerve, and the optic chiasm, and then the optic tract, and then this will go to the pretectal nucleus, and from the pretectal nucleus will go to the Ehringer vestibular nucleus, and then to the postganglionic fibers through the short ciliary nerve right there, and this will cause pupillary constriction on both sides. Okay, pupillary constrictions on both sides. Pupillary constrictions on both sides. And you know that pretectal nucleus is present in the midbrain. So to summarize, you have a direct and consensual right reflex, and this is basically when you shine some light into one eye, it will constrict on that side, and that will be direct light reflex, and constrict on the other side as well, and that will be an indirect or consensual light reflex. In this video is demonstrated, the light reflex is being demonstrated as you can see here. So first of all, you're going to ask the patient to look into the distance, and then you will start to shine some lights into their eyes. Started by any of them and keep alternating between one eye to the other. As you can see, we do it twice in each eye because you want to look at the same eye on the one side and then the eye on the other side on the second time you shine the light. As you can notice, the eye constricts as soon as you start shining the lights on it. Okay. So eye is being constricted on both sides. Next is accommodation reflex, and basically accommodation reflex is when you ask your patient, if this is the patient eye, to look into the distance, look as far as they can, and then you suddenly introduce an object very close to their eye, and what will happen is the pupil will seem to do two things. One, conversions, they will come together, and then pupil constriction as well, all right? And the afferent is basically sent through the same pathway that we talked about. The optic nerve, the optic chiasm, the optic tract, and then the optic radiation as well. And the convergence happens through the contraction of the medial recti, the medial rectus, which is basically an oculomotor nerve supply. All right, and also the pupillary constriction is again oculomotor nerve supply. All right, so this is the accommodation reflex. If you want to define it, it's a convergence plus pupillary constriction on looking to a nearby object, looking from distant to a nearby object. Following that, we have a corneal reflex as well, and this reflex is when you start touching the cornea by a piece of cotton. What will happen? Blinking will start to happen, and blinking happen basically through the facial nerve. So you need to think that the efferent will be facial nerve, and the afferent will be the ophthalmic division of the trigeminal nerve. All right, the ophthalmic division of the trigeminal nerve, and then the efferent will come through the facial nerve and lead to contraction of the orbicularis oculi, causing eye closure, right? So it's a protective mechanism. You'll have some videos covering all of this and demonstrating all the reflexes in the recording. Moving an object toward the patient's eye while they look into the distance will lead to conversion and constriction of the pupil, as you can see here. Vestibulocochlear nerve or cranial nerve number 8. As we know from our introduction that vestibulocochlear nerve or cranial nerve number 8, remember our classification of 2, 2, 4, 4. So when you calculate, you will find that it's going to be the last one of those four. So this is cerebrum, if you remember, and then this is midbrain, and then this is pons. Okay, but it's number 4 in pons, so it's going to be at the very lower end of the pons, just between the pons and the medulla. This is where it is originating. The vestibulocochlear nerve, it's 2 syllables. As you can see here, you have the vestibular nerve and also the cochlear nerve. Vestibular nerve is interested in your position and your movement, okay? Your position and your movement. And the cochlear nerve is interested into your hearing, okay? So one is interested in position and movement, and the other one is interested in your hearing. So starting by the vestibular nerve, and this one is going to be interested in the position and the movement. But what can control your position and your movement? There's something called the utricle and the saccule inside the semicircular canal. So utricle and saccule are responsible for your position, and the semicircular canal is responsible for your movement, all right? So the afferent will start from those two, okay? So it will all come from those two, and then they will enter, the fibers will enter the anterior surface of the brainstem, just in a groove between, we mentioned it earlier, between the pons and the medulla, just in a groove between the pons and the medulla, and then they will end up to be in the vestibular nuclei. And we have 2 vestibular nuclei. So as you look here, this is the semicircular canal. So you have the utricle, okay? And then you have the saccule right there. So this is utricle and saccule. And of course, the semicircular canal will be sort of here. So all the fibers will come all the way down into the vestibular ganglion first, and then they will enter the in a groove between the pons and the medulla, and they will stop sort of into the vestibular nuclei. And the vestibular nuclei are 4 nuclei, as you can see, and these are the medial, the superior, the inferior, and the lateral vestibular nuclei. Okay, so the vestibular nerve, it conducts impulses coming from the utricle, the saccule, and these are interested in your position, and then from the semicircular canal, and this is interested into your movements, and then they will enter the anterior surface of the medulla, anterior surface of the pons, just in a groove between the pons and the medulla oblongata. And when they enter the vestibular nuclear complex, and these are basically 4 nuclei, 4 vestibular nuclei, and these are the anterior, superior, and inferior, and also the lateral nuclei. Okay, sorry, medial, superior, inferior, and lateral. There is no anterior. So medial, superior, inferior, and lateral. All right, so here is the vestibular nuclear complex, and like we said here, that will be that complex. Okay, so it's basically a group of the nuclei located into the base of the 4th ventricle, and these are 4 nuclei: the lateral vestibular nucleus, superior, medial, and inferior. You can call it lateral and medial, superior and inferior. The vestibular nuclei receives afferent from, like we said, the utricle and the saccule and the semicircular canal. Utricle and saccule interested in your position, and semicircular canal interested in your movement. And the fibers from these complex, or this complex, will go to the cerebellum, because we said the cerebellum is responsible for your coordination and also your movement as well. So efferent fibers will pass to the cerebellum through the inferior cerebellar peduncle, and the efferent also will descend uncrossed into the spinal cord to the lateral vestibular nuclei. And just don't worry about the last bit. So basically, this is the vestibular nerve. So as we said, vestibular nerve is interested in 2 things. 1, your position. 2, your movement. The position in the middle ear, it comes from the utricle and the saccule, and the movement comes from the semicircular canal. The afferent will come from that, will go to the vestibular nucleus, and then to the vestibular nuclei, enter the brainstem in a groove between the pons and the medulla, and then they will go to the vestibular nuclei, which are superior, inferior, medial, and lateral nuclei, and you will take it from there and go to the cerebellar peduncle, and then that will be responsible for your movement and your position. The second part of the vestibulocochlear nerve is the cochlear nerve itself, right? So we talked that there is a vestibular nerve, but now there is a cochlear nerve as well. So the cochlear nerve is responsible for your hearing, right? And so it's concerned with your sound, okay, from the organ and corti of the cochlea. So the cochlea is the main thing. So they enter the anterior surface of the brainstem at the lower border of pons, just between the pons and the medulla on the lateral side, okay, because it's 8, it cannot be divided by 12. It's not one of the division of 12. So remember, the cranial nerves in the midline are 3, 4, 6, and 12, so it's not one of them. So it definitely has to be the lateral side. On entering the pons, the nerve fibers divide into branch entering the posterior cochlear nucleus and another one entering the anterior cochlear nucleus. How can we demonstrate that? So as you can see here, this is your cochlea right there, right? So that is your cochlea right there. So you have the cochlear nerve is just basically coming out from there, okay? And then we'll go all the way down, and then they enter the pons, just in a groove between the pons and the medulla, and then they will go to the the cochlear nuclei, and these are anterior and posterior cochlear nuclei. Anterior and posterior cochlear nuclei. Okay, so to summarize the cochlear nuclei here, again, we need to pretty much understand this diagram as well. So you have anterior and posterior cochlear nuclei, okay, situated on the surface of the inferior cerebellar peduncle. Remember the inferior cerebellar peduncle? This is the one that's related to the vestibular nerve. They receive afferent from the cochlea through the cochlear nerve, and the cochlear nuclei send axons that run medially through the pons and end in the trapezoid body of the olivary nucleus. The fibers will end up in the primary auditory complex in area 41 and 42, and this is responsible for basically understanding your hearing. Okay, so I'm not gonna bore you with too much detail about the cochlear nerve, but what you need to know, there is something called the first order neuron, and this is the nerve fiber. The cochlear nerve will send impulses all the way down to the cochlear nuclei, and these are anterior and posterior cochlear nuclei. And then the fibers will go all the way up to the superior cerebellar nucleus, and from there it will go to the something called nucleus of the lateral lemniscus, and finally will end up into the area 41 and 42 to basically translate these nerve fibers into hearing, actual hearing. Glossopharyngeal nerve, we need to establish what we learned earlier about the glossopharyngeal nerve, and that was that, first of all, it's one of the parasympathetic nerves. All right, it's one of the parasympathetic nerves. Okay, and the reason why we mentioned that, remember, we mentioned 1973. So you're definitely gonna mention a parasympathetic nucleus related to it. 2, it's also related to the lateral surface of the brainstem, and of course it's coming from the medulla oblongata. So the nucleus related to it will be coming from the medulla oblongata. First of all, we need to know the course of this nerve. So the nerve itself, it originates from the medulla oblongata, as we mentioned, and then it leaves in the anterolateral surface of the medulla oblongata, and then the fibers will come together and then passes in the posterior cranial fossa, and it will leave the skull, as you can see here in this diagram, into the jugular foramen, right? So this is the glossopharyngeal nerve. So the jugular foramen, it contains, so it leaves through the jugular foramen. The jugular foramen contains, I think I mentioned this in the previous lecture, so the jugular foramen contains 9, 10, 11 cranial nerves, and internal jugular vein. All right. So it will leave through the jugular foramen and accompany with the ninth, the 10th, the 11th, and the internal jugular vein, and also the common carotid artery at the end as well. Then the nerve fiber descends in the neck and accompany with those the internal jugular vein, the internal carotid artery inside the carotid sheath, and they will reach the stylopharyngeus muscle. This is basically the efferent fibers. Following this, it will move even forward and just between the two constrictor muscles of the pharynx, and they will end to supply the sensation of the pharynx, all right, and also supply the posterior third of the tongue. So you can imagine that here we mentioned some motor supply of the nerve and also some sensory supply and some parasympathetic supply as well. So this is definitely a mixed cranial nerve. So this nerve has three nuclei, all right? It has three nuclei, and these nuclei are the main motor nucleus. You can imagine from the name that this will be related to the stylopharyngeus muscle, because this is the only motor part of the glossopharyngeal nerve. And then you also have the inferior salivary nucleus, and from its name, it's related to salivation, and that will be related to the parotid gland, and this is actually the parasympathetic part of the nerve. And finally, it's related to the sensory, okay, the sensory part of the glossopharyngeal nerve, and you can imagine that this will be related to the tongue, the posterior third of the tongue, and also the mucous membrane of the pharynx, okay, the mucous membrane of the pharynx. All right, so let's go back to the main motor nuclei. The efferent, it's very easy to remember the efferent because you know that the only motor part related to the glossopharyngeal nerve is the stylopharyngeus muscle, okay? And the afferent will be coming from the both cerebral hemisphere, something called corticonuclei, all right? And then this will be located deep, all the way down, deep in the reticular formation of the medulla oblongata, and it's formed of the superior part of the nucleus ambiguous, all right? So as you can see here, of course, that's midbrain of that, and then the belly is the bones, and then finally this is the medulla oblongata, okay? This one is called the nucleus ambiguous. So the superior part of the nucleus ambiguous is the corticonuclei of the main motor nucleus. So the main motor nucleus is the superior part of the nucleus ambiguous. And then the afferent fibers will go all the way down to from both cerebral hemispheres, and the efferent fibers will go all the way down to the stylopharyngeus muscle. As you can see, the color here will go to the stylopharyngeal muscle or pharyngeus muscle, okay? Secondly is the inferior salivary nucleus, and these are the parasympathetic nucleus. You can imagine that it receives some impulses or the fibers from the hypothalamus and from the olfactory, but mainly in the taste as well, okay? And of course, the efferent will end up into the parotid salivary gland, because we mentioned earlier that the salivation from the inferior salivary nucleus will be related to the parotid salivary gland. So this is your efferent, where your efferent terminate, and it all starts from the hypothalamus, and also the olfactory system and the taste system as well. I think this diagram is even better for it. So you can imagine here that this is the glossopharyngeal nerve coming from the inferior salivary nucleus. The fibers will go here and pass through the tympanic plexus, and then lesser petrosal nerve, and then this is the otic ganglion, and then this is the greater petrosal nerve, and they will end up into the parotid gland. So this is the glossopharyngeal nerve, or the parasympathetic part of the glossopharyngeal nerve. Fine. So moving forward, you have the last nucleus, which is called the sensory nucleus. It's part of the nucleus of the tractus solitarius. All right, tractus solitarius, and the sensation of taste travel through the peripheral axon of the nerve cell situated in the ganglion of the glossopharyngeal nerve. This is all I want you to know about the sensory nucleus, that it's related to the taste fibers in the ganglion of the glossopharyngeal nerve. Maybe you can read the rest just to understand what's behind it. Okay. So next part is a quite common topic, whether from medical school or generally the higher exams like MRCS or in different exam. So you need to know the boundaries of the triangles of the neck and sometimes the content of these triangles as well. So triangles are generally classified into anterior and posterior triangle. And the main, if this is the mastery process, and if this is the clavicle and attached to the, obviously the uh, sternum. Okay, so you have a muscle in here coming all the way down, which is called the sternocleidomastoid muscle. So anterior to it is the anterior triangle, and posterior to it is the posterior triangle. Okay, so moving forward, so again, yeah, this is the sternocleidomastoid muscle, starting from this one, sternocleidomastoid muscle, and obviously it's coming from the outer surface of the mastoid process, and they're inserted by two heads. You have a sternal head and a clavicular head in here. Okay, sternal head and clavicular head. There is a small space between them, as you can see down there. Okay, so anterior to it is the anterior triangle, and posterior to it is the posterior triangle. So what about the boundaries? So let's talk first about the anterior triangle. You have anteriorly, it's the midline, just an imaginary line in the midline, and superiorly, you have the mandible all the way up. Okay, sorry, and the posteriorly, you have the anterior border of the sternocleidomastoid muscle. So this is the anterior triangle of the neck. However, this triangle is divided into four subtriangles, starting from this important muscle, digastric muscle. So right there. So this is the digastric muscle, anterior and posterior belly of the digastric muscle, right there. So it will divide it into triangle above it and triangles below it as well. However, there is another muscle as well, which is a very important muscle as well, called omohyoid. It's a critical muscle. So you have part from here, that's the superior belly of omohyoid muscle, and another part there, the inferior belly of omohyoid muscle. Okay, so let's look at how many triangles do we have now. So you will have a triangle in here. So this is, it's just below the mandible, so it's called submandibular triangle. You have a triangle in here, which contains lots of muscles. We call it muscular triangle. You have another triangle in here, which mainly contain the carotids. We call it the carotid triangle. And another one, a very small in here, is called subtriangle. It's called submental triangle as well. Okay, so four subtriangles in the anterior triangle, and we know it's divided by the anterior and posterior belly of digastric muscle and the superior belly of omohyoid muscle. Okay, so now we can say the boundaries of each of these triangles. The subdivisions of the anterior triangle as well. And also, you can, if you look at the posterior triangle, you can see that this is the inferior belly of omohyoid muscle dividing into two triangles, which is, this is the occipital triangle, just above it, and below it is the clavicular triangle. All right, so okay, so starting by the borders of the anterior triangle, like we said, midline and anteriorly, and sternocleidomastoid posteriorly, and the mandible superiorly. The subtriangles, we mentioned the submandibular triangle, and we can name the boundaries for the submandibular triangle. You have the anterior belly of digastric and posterior belly of digastric, and also the mandible superiorly as well. So you have the mandible, the anterior belly, and the posterior belly, just like that. So, and it contains mainly the submandibular salivary gland and some submandibular lymph nodes as well. The facial vessels, artery and vein, which will be just anterior. If you have this, the masseter muscle, you will have the vein and the artery just anterior to it. You'll have a nice diagram that will be shown in a bit, and also the hypoglossal nerve. So you have the submandibular gland, which is deep and superficial part, and you have the hypoglossal nerve, which is found in between the deep and superficial part, in addition to the facial vessels, so facial artery and facial vein as well, and some lymph nodes just present all the way around. So these are the contents of the submandibular triangle. Okay, so looking at this one as well, so it's even further division. So you have here, this is the mylohyoid muscle, digastric muscle, and the posterior belly of digastric muscle will be right there. I think this is from Teach Me Anatomy. You will have here that's a triangle containing submandibular salivary gland, submandibular lymph nodes, and so on. That's a submental triangle. The boundaries for it is anteriorly the midline, and posteriorly anterior belly of digastric muscle. Inferiorly is the hyoid bone, and it contains mainly the fluorosphere by the mylohyoid muscle. You have the carotid triangle. The carotid triangle boundaries will be again is and if you go back to that nice diagram, so this is the carotid triangle. Anteriorly is this muscle, which is the superior piliofemohyoid muscle, posteriorly cleidocmastoid muscle, and superiorly part of the hyoid bone, and the posterior digastric muscle as well. And it contains the carotid sheath containing the internal carotid artery and part of the common carotid artery, and the vagus nerve as well will be there. Okay. In terms of the last triangle, which is the muscular triangle, remember the boundaries is hyoid bone superiorly, midline anteriorly, and also lateral on both sides. You have the superior piliofemohyoid muscle, and the inferior is the sternocleidomastoid. If you go back again, so that's the muscular triangle. You have this one and this one. So sternocleidomastoid and superior piliofemohyoid and midline anteriorly, and the hyoid bone in this area. It's not actually a triangle. It's sort of coming in the way like that, right? If that makes sense. So it's not really a triangle, and it contains all the suprahyoid, the infrahyoid muscles, and we will explain them in a bit. Okay, so it contains the strap muscles or infrahyoid muscle. These are the infrahyoid muscle. You have they come from the sternum, so you have a sternohyoid, sternothyroid, and thyrohyoid muscle as well. Okay, so this is the muscular triangle, and like I said, it doesn't look like a triangle. It's sort of that shape. Okay, great. Finally, the posterior triangle. This is a very nice diagram as well from Teach Me Anatomy. So you have here this is the boundaries, posterior border of the sternocleidomastoid, and the part of the clavicle, middle third of the clavicle, and also the anterior border of the trapezius muscle posteriorly, and it contains the inferior piliofemohyoid muscle divided into two further triangle. So that's one, and that is two. So I mentioned the boundaries, sternocleidomastoid, trapezius muscle, middle third of the clavicle, and the apex is mating of the sternocleidomastoid and trapezius muscle. It contains the anterior, middle, and posterior scalenus muscle, and levator scapula, and capitis is splenius capitis as well. So it's all these muscles. So you have your splenius capitis and scalenus anterior, scalenus medius, and the scalenus posterior, and also another muscle, which is the levator scapula, which will be this yellow bit. Okay. Divided, like we said, inferior piliofemohyoid muscle into occipital and subclavian triangle, or the clavicular triangle. Contains some nerves: accessory nerve, phrenic nerve, brachial plexus, cervical plexus, vessels, external jugular vein, and subclavian artery, and muscles, like we said, all the muscles, and lymph nodes, supraclavicular lymph node, and occipital lymph nodes. These are the contents. All right. So we're gonna come to explaining all the. So you have here the spinal accessory nerve. You have here crater-auricular nerve as well, and it contains the brachial plexus between the middle and anterior scalenus muscles, and also the phrenic nerve, which comes from the part of the brachial plexus C4, 5, and 6, and vessels like, say, jugular vein and subclavian vein.